Hi, everyone. Thank you for joining us for today's coffee chat. My name is Daniel Truckenbrough, and I'm an Associate Marketing Manager at Brooks Publishing. And today we have Drs. Jane Squires and Diane Bricker to talk about the new ESQ, the Environmental Screening Questionnaire. So before we begin, I just have a couple of things to cover. First and foremost, we have a few webinar tips. If you have any applications open, such as email or other web browsers, if you go ahead and close those, that can increase bandwidth and improve your viewing experience today. If you have any questions during the webinar, we have a questions tab in the webinar panel, and you can go ahead and enter your questions into that tab, and then we'll be taking a few questions at the end during our Q&A session. And if you'd like to minimize the webinar panel, there's a little orange arrow at the top. You can click that, and that'll minimize the panel. And then if you'd like to expand it again to adjust any audio settings or enter any questions, you can click the orange arrow again, and that'll expand the panel. And if you're experiencing any audio issues during the webinar, please check the audio tab and make sure that your speakers are turned up. And you can also try reconnecting to the webinar, just exiting out, joining back in, and that should usually alleviate any other issues. And a few other things, if you would like to download these slides from today's webinar, you can download those in the handouts section of the webinar panel. And this webinar will be recorded, so tomorrow afternoon you'll receive an email that'll have a link for you to download the slides and watch the recording of the webinar. And certificates are available for all attendees and webinar viewers, and I'll provide a little bit more information towards the end of the webinar about certificates. So today's presenters are Drs. Jane Squires and Diane Bricker. Jane Squires is a professor in the Early Intervention Program in the Center of Human Development at the University of Oregon. And Diane Bricker is a professor emerita in the Early Intervention Program at the Center of Human Development, also at the University of Oregon. Jane and Diane are both co-developers of the renowned ESQ tools, ESQ3 and ESQ-SE2, and they're also co-developers of the ESQ, which they will be talking about today. So without further ado, I'll turn it over to Drs. Jane and Diane. Thank you so much for joining us today.
Okay. Good morning, good afternoon. We're delighted to be here and have an opportunity to talk to all of you about this new addition to the ESQ product line called the Environmental Screening Questionnaire. We hope to give you, to begin, to give you just a little bit of background, and then we'll shift to Jane, who will give you the details about the ESQ. And as Dan mentioned, you have the opportunity to send in questions that we can try to address towards the end of this presentation. I think I can say for both Jane and I, we are very grateful to see over the last 10 years an expanded interest and challenge to try to look more carefully at young children's environment. If you go back historically and look at the way we have viewed children, initially it was heavy emphasis on genetics, and so that if someone came not whole, there was the attitude that there wasn't much to do. Over the years, we have accumulated an enormous amount of research on how important, how fundamentally important the environment is, particularly to young children. The old adage, as the twig is bent, so grows the tree. And all of you are professionals out there, and I'm not telling you anything that you are not aware of. But we are encouraged that lately, through things like the ACEs studies, there has been over the last 15 years a renewed, at least we think so, a renewed interest on trying to get our hands around children's environment in the sense of early detection, early intervention, and we all know that's the hallmark that makes a difference for so many children. So the ACEs study, as you see in this slide, was conducted in 2006. Next one, Dan, please. Dan? Thank you. has led the ACEs studies and a lot of other research that many of you are quite familiar with, has led to this, I think, globally accepted concept of the social determinants of health. And again, I'm sure all of you in the audience are familiar with the SDOH and how important it is to understand how those variables affect young children. Next, please. This slide shows you the parallel between the social determinants of health and the environmental screening questionnaire. It's interesting, although there are 6 areas in the ESQ and only 5 in the SDOH, there is a definite parallel, and we, on the screening instrument, we cover all those variables that have been identified by the World Health Organization as well as other entities as really fundamentally important in children's lives. Next, please. To step back a little bit, this is what we hope the SDOH screening translates into what the ESQ does. It looks at factors known to impact development. It looks at protective and risk factors. And let me step back just a moment to talk about the relationship between the ASQ and the ESQ. When Jane and I started working on the ASQ back in 1980s, can you believe 40 years, we were always interested in trying to figure out how to assess children's environments. For a lot of reasons, we were never able to pursue, even though in our minds we knew it was as important to understand children's environment as it is to understand their development and where they are developmentally. However, a lot of our time and energies was directed to working on the ASQ and the ASQ-SC over time, and it wasn't until the 1990s that we had the time and resources to go back and look at, could we possibly do some sort of intelligent, useful screening of the environment. And so we went back in earnest and started working on the ESQ, which we've been doing since the mid-1990s. More recently, we have been able to accumulate resources that have permitted us to do some data collection on the ESQ and to begin to use it more widely. I think the important thing for you to remember is that as children grow, it is really essential that we look not only at their development, but we look also at their developmental maturity over time, but also the environmental conditions that children are being raised in and how important that is. We have great hopes that the ESQ may turn out to be a useful screening tool. In the next few years, Jane and I are dedicated to doing some very serious data collection on the use of the ESQ, which, like the ASQ, we have modified, revised over the years, and we're suspecting that as we collect more information, it will make some changes in the ESQ. Anyway, we are now committed to this screening tool, and we hope we now have our 3-legged stool more stabilized with the ASQ, the ASQ-SC, and now the ESQ. Jane, I think you're next, right?
Mm-hmm. So that, as Diane mentioned, that the ESQ, and it does sound a lot, ESQ, ASQ, they sound very similar when you're saying them, but the Ages and Stages Questionnaire is the ASQ, the Environmental Screening Questionnaire is the ESQ, and the ESQ was created by the developers of the ASQ. And our idea was to have another companion to our developmental and behavioral screening kind of components that would gather information about a child's home environment. It can be used with children from birth through 6 years, so it's the same age span as the ESQ and the ESQ-SE. And it's really wonderful that Brooks is offering it to you free, that you can download it digitally, and Dan will kind of give you the information about that at the end of our presentation. So there's 6 areas on the ESQ, and each have 5 questions. So there's 30 questions in all. And as Diane mentioned, we really looked at the social determinants of health. We looked at ACEs. We looked at our research we had done with families to see what are the things that are really strengths that will really help in terms of determining families' strengths and the positive things we can use if they're suffering from risks. And then also, what are the things that we know are really, really difficult, such as some research we did with Head Start. When a family moves more than 4 times in a year, it's really difficult for the kids to keep on track developmentally, socially, so on and so forth. Domestic violence, those things. So we kind of had to pick and choose. We actually decided we really needed a question about reading and singing, and so we took another question out and combined it. So it's been kind of it's been very difficult to filter down the questions to these 30. So you might say, oh, this is missing, or why do you have this on? But this is our, based on the research that we've done and it's in the literature. This is kind of our 30 questions that we think are the most critical in determining families' strengths and also where they need further support. It takes about 10 to 15 minutes to complete, and right now it's available in English and Spanish. We expect it to be available in other languages soon. Okay. Takes about 2 to 3 minutes to score, and the scoring for those of you who have used the social and emotional ASQ, the ASQ-SE, the scoring's the same, so that risk factors get scores. So a high score says that the family is experiencing a lot of risk. A low score says they are not. They still may need some supports, but we're not really, really concerned about them right now. So and we have, like on the ASQ-SE, there's zeros. There's a Z, which is 0 points, and then there's an X, which means 10 points, and concerns get 5 points. So higher scores indicate that a family would benefit from some follow-up supports. Okay, next. So these are the components of the ESQ. So there's a very brief guide which tells you some of the things that Diane has mentioned about the background, why the need, why we created it, what we hope that it will do. It also talks a little bit about the scoring process and what the procedures would be. Then there's a questionnaire itself, which is the 30 questions. And then the referral and summary page is probably the most important page, because on this referral page, what the provider does is goes through and with the family and figures out for these areas, for these 6 areas, where what were the scores, what were the risks, right, and then what resources are needed. And we have added some resources in here. I think, Dan, you were just in that 3rd column there about resources. What resources might a family need? We also urge you to add your own for what you have in your community, so that it's really important if you're going to use the ESQ, first of all, that you have someone that can preferably sit down with the family and administer it, spend some time with them, and second, you've got to know your community's resources. If you do, if you complete the ESQ with them and they have really a lot of needs and there's absolutely nowhere to send them, then you're in a quandary, right? I mean, it may be beneficial for the family to talk about this, but you really need to be able to problem solve with them and to figure out what are the next steps. And then so that the fourth column on the referral and summary page is the action. And again, this kind of resources and action is a key part, because we want to figure out what families need to really support the development of their children, to lessen the risk and the ACEs scores for the children, because this is when we can do it, when the kids are young. If we can kind of lessen some of the stress and these adverse conditions when the kids are young, we know they'll have better outcomes. They'll have better health outcomes. They'll have better social outcomes. They'll have better school outcomes. So that's the kind of idea of the ESQ, is that we're going to give those environmental supports to families to allow them to be better parents and to also support their child's development. Okay. So in the guide, I mentioned that's the first part. It's very brief. It's, I don't know, 10 pages or something. We talk about the fact that what it is, it's a brief screen that will assess family strengths and needs, and will identify some of the risk and the protective factors that might affect parenting. So we really want to figure out with the family what their strengths are, but what are some of those things that would really help them be parenting. We've already really talked about what the ESQ assesses, is those social risks, those social determinants of health, the ACEs, assesses those and tries to find where prioritize. There's some families that may have a lot of needs and prioritize those, or there may be a family that just needs, a counseling session on behavior for their child, might need fewer. Administering the ESQ, as we talked about, we would prefer that you sit down with a family and go over it. We do, there are some people that have put it on their websites with the ESQ, but I think it needs personal follow-up. It can't just be that you have a family complete it and then you don't get back to them. So I think that human touch, whether it's, over video chat or the telephone or whatever, right now, that you really need that personal contact when you're filling it out, and then once that the resources are in your community, you know what they are and what the next steps are, because a family isn't going to take those next steps to be referred without you giving kind of a warm hand off or a warm link to them, calling that next, the counseling center, or someone who can help with food, the food bank. So families really need, many of them, guidance for that next link to the referrals. Introducing it to caregivers, we talk about some of the things that just, we want to make really clear that families don't have to complete all these questions, that some may feel some of are invasive. They might not, they're probably not all culturally appropriate to every culture. I think that's impossible. And so if a family doesn't want to answer it or doesn't feel comfortable, then that's fine. You just can skip any questions that might be problematic with families. And you have them go through each of the areas, answer a yes or no, and then if that's a concern. And what you could do with the concerns to the family is then to prioritize those and use the concerns as a way to inventory what kind of resources they need and what connections they need to the community. Okay. The scoring, I think I mentioned that you can see the page on the left here, that the print's kind of small, but if a family checks something that has a 0 under it, that's no points. An X is 10 points, sorry, and then a V is 5 points, just like the ASQ SE is. You would total each of the areas up for area scores, and then you can also do an overall score. I think Diane mentioned that we have some research Right now, it's really, we call this a research edition. It's very preliminary. We're planning on doing more research on this. So what we have are some scoring guidelines, such as if a family has more than 30 points in the area, then you might think about referring them, making sure they have resources, and or if there's concerns. We believe, as in the ASQSC, that you need to follow up with the concerns that a family has. So following it, and also rescreening. So maybe seeing families in 6 months and 9 months and saying, let's sit down, let's discuss this. Let's say, how are you feeling about these items that you felt were really difficult for you and your family? Did the resources help? What else might you need? So again, you can see that as a program, you need resources to be able to use the ESQ. You can't just kind of slap it on and think it's going to be paperwork that you can just get done. But it really, again, I think it needs some sort of a human touch points to be effective and to really use it as we've designed it. Okay, next. So this is giving you kind of a more in-depth look at the ESQ. This is the first page. So the area there is education and employment. So some of the questions: do you have a high school or GED? Do you have language problems that get in the way of you finding or keeping a job? Do you have problems with reading or writing? Again, as I mentioned, if there are things that a family might be sensitive about, such as difficulties with reading or writing, skip those. You don't have to answer them. You can still, there's plenty of questions and ways to get information from a family if there are questions that really aren't appropriate to ask them. Second area is at the end of that, there is, if you checked concern, what kind of follow-up do you need? So sometimes families don't know. In this case with Jane Smith, she could help. She could get help. She could use help finding jobs or training job classes to help her get more employment. So her total score there is 25. As I mentioned, this is a rough estimate. 30 is where we really think that you need to look at whether to refer that family for sure. This would be a case where I would say, let's find that referral. Let's see if there's any available training programs that we can refer her to. Again, the second area is housing. Do you consider yourself homeless? The options, as I mentioned, yes, no, or concern. There may be families who, for instance, are living in a very crowded household, but that's not a concern to them. That's not, it's helping them because they need childcare for whatever reason. So again, I think looking at the yes and no is important, but also whether that's a concern for that family. Mm-hmm. Mm-hmm. The last area on this is child and family health. So again, trying to say, do you have substance problems? Do you have access to health care? Does anybody in your household have problems, mental health problems, physical problems? Does your child have learning or behavioral problems? And again, which are these concerns? What kind of help do you need? And as I mentioned, the professionals can use the lines at the right, down the right column to write the scores and then to total those with each of the areas, and then a grand total at the end. Okay. So this is the second page, economics and finance. Do you have enough food? Does your income cover your monthly expenses? Do you use support programs, or do you have them, such as WIC or SNAP? Any credit problems? Family life, do you have a good relationship? Do you have conflicts with a spouse? Does your children, do you have child care that meets your family's needs? And I know that's a problem with many, many families right now. And the last area is the community, people to talk to. Does your child get along with other children? Do you have family or friends that can help you out? And again, this community area, and there's a couple others that are made much more difficult for the COVID times right now. So again, you have to use some interpretation because there may not be any things that you can do right now. You're gonna, in terms of making, and getting resources for some of these family community problems. All right, next. So as I mentioned, this referral summary form I think is the most important. What you would do as a professional then is to write the scores in each of the areas in the second column and circle the resources that were needed. Again, we really urge you to add some resources. When you've used this, Diane and I would also like to hear from you to see what needs to be added, what needs to be taken away. Are there resources that we didn't think of? We tried to be very general and have things that pertain to all communities. But we know that we've left some out and that you will need to personalize these or individualize them for each of the communities that you're in. And this action taken is the most important thing, because unless you take action, then doing the whole ESQ is not really going to be as beneficial for families as it could be. So the process of going through with families, seeing what their strengths are, where their needs are, but then really helping them fill those needs is what's key to making the ESQ valuable. Okay. And this is just going more in detail in case you couldn't see the last slide. The education and employment area, the score was 25, so that's near that 30 really risk cutoff. Job training, and then provide a list of job training classes in the area and help coordinate attendance. So again, giving kind of that warm transfer to the community, helping that family to that next stage, not just kind of handing in a piece of paper and say, okay, this is the name of the agency, you go and contact them, because families have a hard time doing that. So you really need to help that that liaison between your program and whatever's in the community. So the research, this is initial research. So we mentioned we had a sample of about 350 people, some from agencies that were serving families at risk, such as drug treatment, counseling, family counseling, residential, family residential settings. And then we had an online sample. We looked at convergent validity with the parenting stress index. And we did see that for the online sample that the ESQ scores correlated with the parenting stress index, the short form of that. For validity, we looked at, do ESQ scores predict ASQ SE scores? And we found that for 4 of the intervals at the younger ages, we did see that prediction. Again, the samples were really different in terms of having a really typical sample without a lot of risk and then a very at-risk sample. And so some of the reasons for maybe the lack of having prediction across all the intervals is due to the limited samples that we had. Reliability, there were significant correlations by area for the online group. And then utility, easy to use, informative. People were very happy with it that filled it out. Right now, the ESQ is on our Ages and Stages questionnaires research site. We're gathering data for the 4th edition of the ASQ. And that site, and maybe somebody at Brooks could write it down too in the chat, is agesandstagesresearch.com. So families or any of you with young children between birth up to age 7, there's the ASQ4. So our new ASQ that we're gathering data on, which we hope is an improvement, more kind of generic and improvements in some of the scoring and the items. So the ASQ then followed by the ASQ SE2. And then we have an articulation screening test that Diane has developed with some other collaborators. And then finally the ESQ comes at the end. And surprising to us in this line of 4 assessments that we have volunteers completing online, 80% have filled out all those questionnaires and gone to the ESQ and have really liked filling the ESQ out. And so again, that was really great information for us, because we weren't sure how people that are mostly on non-risk families that are computer literate, how they would feel about it. So if you want to see all those questionnaires, fill them out for us. That would be great. And you can see, in addition to downloading it, you can see it in this online format. Okay. And who is this for? Who can use this? I think, you know, a really natural group is the home visitors and parent educators. So nurse partner familyships, early Head Start parents as teachers, because they're in the home environment. They're often looking at the environmental supports that a family may need, especially in those early years with their children. So that's, I think, a really natural audience. Early interventionists, if you have a child who is eligible and you're working with them, we found many of our families with children with disabilities need these supports. So again, filling it out when you have an intake. Social workers may want to use it, even if they're not gathering a lot of developmental information. They could still look at what does this family need to help them support their child's development, because we have to support families in supporting their kids, or that's not going to happen. Pediatricians, we have some pediatricians who are already using it, who are really interested in both looking at maternal depression, caregiver depression, as well as the environment and what families need, again, for good parenting. And then people working closely with high-risk, multi-stressed families. This would be a good fit for them. And I think, Dan, you were going to talk about the nitty-gritty about how to get it.
Yes, absolutely. Thank you, Jane and Diane, for that excellent overview of the ESQ. Okay, so again, if you have any questions, you can go ahead and enter those into the questions tab, and we'll be covering those in just a few moments. But first and foremost, so how to download the ESQ. The ESQ is available on the Brooks Publishing website. It's www.brookspublishing.com. And you can also go directly to the ESQ page here at the short link at the bottom, bpub.fyi/ESQ. So users, once you go to download the ESQ, you will just add it to your shopping cart as if it was any other normal product on the Brooks site. And you won't need to add any payment info because ESQ is free to download. But if you don't already have an account on the Brooks website, you will need to create one that's free to create, and you just enter your email address and the information requested, and then you can create an account. And then once you have your account created, you'll accept the user license agreement, and then you'll download a zipped folder of the files. And then you can just extract those files and save those on your computer. And if you need to go back in and download the files again, you can always just go back into brookspublishing.com, log into your account, and then you'll have those files available for you to download under your account. And once you've downloaded the ESQ, you'll have a few files available for you. You'll have the 17-page PDF that's a user's guide about the ESQ and how to use it. And then you also have the forms, and these include individual PDF questionnaires and referral summary sheets in both English and Spanish that are available for printing. And if you'd like to learn any more about the ESQ, all of these resources are also available on the ESQ product page on the Brooks website, but they can also be found on these short URLs here. So we have an ESQ at a glance. It gives you a quick overview of the ESQ. It's a much more brief summary of the aspects of the ESQ, including purposes, area covered, age range, just a very basic overview of the environmental screening questionnaire. If you'd like to look at samples of the ESQ, we have English and Spanish samples. You can see a little portion of the screenshot here. It shows you what a sample completed ESQ would look like. And then we also have a using the ESQ article. So this is a newsletter article that we've published, and it gives you information about how to use the ESQ in your setting. And then it also provides links for downloading. So it's a good article to go back to if you're using the ESQ and you have any questions. You can look at that article as well as the user's guide for any information for using the ESQ. So with that, we can open it up for questions. I apologize if you see my mouse moving around. I'm just searching through the questions tab. So let me get myself situated here. Okay. So we have a listener who's asking if this can be used in a childcare setting, or if it would be appropriate for the ESQ to be used in a childcare setting.
Yes, but the childcare setting, I think it needs a couple of requisites. First of all, you have to have someone who knows how to deal with families that may be troubled. And secondly, they need to have a resource list available. So if they discover some need by their family, they have a strategy to help that family get to that resource. Jane, anything else?
No, I would agree to that, as long as they have someone that's kind of trained in working with families and helping them with resources. That United Way has, usually they have a nice list of community resources. I don't think you have to invent that yourself. There's usually agencies or kind of coordination agencies in communities that have gotten those, but you really need to get your hands on that before you would give the ESQ.
Yeah. Let's see. We have a listener who was asking, when do you recommend that the ESQ be administered? Is there like a certain schedule, or how would you? Is there a timeline that you would use the ESQ?
One of the things that I would say is that you need a relationship with the family before you can do it. And if you were going to start with screening, I would probably do developmental behavioral screening first, talk about those results, and then have the family complete the ESQ. I think that that you need some sort of relationship and some trust with them before you can do the ESQ and really get an honest assessment of kind of where they are and what they need. That's just my opinion. So,
I agree with that. And the other thing that I would recommend is that program staff have sat down and talked about how they're going to use it, what schedule they're going to use. It shouldn't be something that you're sitting in your office and you say, oh, maybe we should give the family this. It should be an organized, systematic approach to how you use it and what you do with the information. So I would prefer people not use it until they've actually sat down with their staff and they have some systematic way to implement it and then follow up with it.
Yeah. Kind of on a similar thread, we had a listener who's asking, how do you envision this questionnaire being filled out? Would you recommend that a parent fills it out with the provider next to them, or would you recommend that the provider fill it out based on what the parent is saying, responding to questions? Do you have any recommendations for actually conducting the ESQ?
I would say that whoever the professional person is, that the first step would be to say to the parent, how would you like to do this? I think, as Jane mentioned several times in the presentation, we don't recommend that you put this in the mail and send it to families, or that you just give it to them and say, good luck. Rather, we would like people to sit down and work with a parent to fill it out. Now, again, that will be somewhat dependent on what the family's need is, what the caregiver feels. And so we would hope that staff would do some negotiation with families rather than just have one size fits all.
Mm-hmm. Do you have any recommendations for when a provider may be completing the ESQ with both parents, and one parent may have different answers or different information than the other parent?
Go for it, Jane.
we've had that even with the developmental ASQ, where or the ASQSE or family is eating time stressful, and one parent will say at the same time no, and the other parent will say yes. So families do have, I mean, people do have different impressions, and I think that rather than to get into that, you can say, yes, you know, you have this this need, or you feel like you need this resource, you don't feel like you need that. What would you like to do? What would be the next step? Because I don't think you want to get involved with couples counseling at that point, but at least to give resources to families if there's one parent who really feels like they need these next steps and that something is really hard for them. Because I think it makes sense that it's not going to be hard. Things aren't going to be hard for everybody to the same level. And what are going to be concerns may be, you know, much more concern for a primary caregiver who stays home all the time than for somebody who is not there as much, or vice versa. So.
Let's see. I know this was touched on a bit in the presentation, but we have a handful of listeners that are also asking if there's any training that's required in order to use the ESQ.
I don't. A lot of it has to do with the professional's background and how often they've dealt with families that are troubled or have significant needs. And that's why a few minutes ago I said staff should sit down and have a system for how they are going to use it, what they're going to do with the feedback. And they should also be talking about, if they do run into a family who has significant needs, what's their strategy to deal with that? If they don't have a strategy, I probably would recommend, I don't know if Jane agrees, not to use it, because I don't know if it, unless you're trying to build a case that we need more resource, and I think that's legitimate. I think I'd be very careful to use it until I've figured out how it fits in our system, what we're going to do under said conditions, and how we're going to follow up with it.
I agree.
Let's see. We have a few listeners who are asking, so the ESQ has a target age range that it's meant to be used on, but we have a few listeners that are asking if you think it's appropriate or acceptable to use this screening tool with children that are older than the specified age range, or is it only really applicable for younger children?
You know, I think a lot of it's applicable for, you know, for school-age children in general. Of course, when kids are teenagers, there may be some questions that aren't, but I think it's getting at some of the kind of the child rearing dynamics, some of the problems that families with children have. So I don't, you know, we certainly haven't tested it with older kids, but I would think that it would be very appropriate. Or again, we really urge you, if it's not appropriate, don't answer all the questions. They don't need to be all answered. So you might have to omit a couple if that wasn't relevant to that family with older kids.
Yeah. All right, let's see. We also have a couple of listeners who are asking if you have any guidance or recommendations about rescreening with the ESQ, depending on a concern that may be noted.
You know, I do. Go ahead, Jane.
I think it's a good idea to do, definitely. And, you know, the time frame, you know, I think you'd have to wait at least 6 months in most cases. Checking back with the family and saying, did you use the resource? You know, maybe in an informal way, did that help? Do you still have concerns without totally administering it again? You could certainly do that, but I think it's really important to think about that as kind of a baseline, and that you really need to check back in with that family to see where they are, and then, you know, maybe in 6 months, 9 months at the end of the school year, whatever, to redo it and say, you know, or just say, has anything in this changed? I don't think you have to go through it all again with some of the families, but I think it's a great idea to kind of use that as a baseline document.
Yeah, Jane and I have struggled for 40 years over how do you use the results from screening tools. And our recommendation is always, it's a screening tool. And screening tools are just to sort the users or the target population into two groups, those who look okay and those who do not. It is not a comprehensive assessment, neither is the ESQ. It's a screening tool. So one needs to be very cognizant of that. We wrote an article a long time ago. Do you remember do you remember what we called that? Anyway, we tried to deal with the issue. And basically, I think what we said is, as scientists, our position is the use of screening outcomes needs to be very circumspect. However, if that's all you have and it's only resource that you have in a program, then we would rather you do that than do nothing. So I hope people understand that qualification. We feel like scientifically we cannot stand on the podium and say, yeah, you could use it as an evaluation tool. We can't do that. We don't feel that's defensible. But we do say, if it's all a program the resource that you have as a program, that's what you can do. It's better than nothing. Is that fair?
Mm-hmm.
Yeah, it was stretching the ASQ.
Oh, thank you, thank you. If anybody wants to see it.
Let's see. We have a listener who's asking if you could see any value in using the ESQ with pregnant moms as sort of a chance to give a heads up and an opportunity to be proactive for any potential concerns or at-risk families.
Sure. But again, I get back to what I just said, one needs to be very, very cautious. We have alluded to the ongoing data collection that we are doing with the ESQ. We are right now dead in the water, as everybody is, trying to go out into the community and collect data. You can't do it. But I think once we get the pandemic under control, we have every intention of doing significant data collection, and we might actually target some populations like that. It would be, I think, helpful to us if anybody has an idea or an area that you think we might not have thought of. Send us an email, and we're in the formulation stage in terms of the research that we're going to conduct in the next 4 or 5 years. So if anybody has any suggestions, I for one would be very, very pleased to get those suggestions. And it always, for me, it always broadens my thinking if I get input from a lot of different sources.
Yeah, I agree. I think using it with, mothers, parents who are about to have children is a great, I mean, that's early intervention, right? And so I think that's a great idea. Again, it might not all be pertinent, but just to prepare the family and to see what might make their parenting easier. So I think that's a great question.
Yeah.
Jane said a little while ago when in the presentation, she was talking about the online version of the ESQ, and nobody's more surprised than me, the number of people who have, caregivers, parents who have chosen to complete it. And I don't think we've gotten any feedback about it being invasive or caregivers being upset about it or that it wasn't useful. And I must tell you, I'm surprised about that. I thought we might get a lot of comments from folks saying, I don't know, this is pretty invasive. But so maybe it's the professional group. Maybe we're over thinking this and over apprehensive, and maybe caregivers and parents see the value there and they don't see it as intrusive. We intend to pursue that area and look at it from a research perspective, but I've just wanted to tell people I've really been surprised at the number of people who have chosen to complete it online and the fact that we're not getting any negative feedback.
Yeah, that is interesting. Let's see. We have a listener who was wondering if you have any information or understanding about potential Head Start use with the ESQ.
Okay.
I guess, oh, sorry, go ahead.
Okay, well, it's so new that we do not, I mean, I have not talked to anybody in Head Start. I would think like the family specialist, this would be a really good fit for them to use with an intake with families. But I don't believe that we, we work a lot with our local Head Start programs on different things, but I don't think we really, asked them in depth to review it. So that's something we can put on our list. It's a good idea. And again, if people from Head Start are listening or want to give us some input, we'd love to have that.
And a bit more of a questionnaire specific question. We had a listener who, I guess, we'll kind of like backtrack a little bit. We had a listener who was wondering what the total number in our sample, there was the number 55 on the end of the questionnaire. So they're wondering what that total number tells the provider.
We don't have, we have set like 30 in each of the areas. We do not have any indications for the total points. You could certainly use that in terms of, again, informal evaluation of your program to see if you would want those total scores to go down, to mean that the family had less concerns, less stresses, they were getting more of their needs met. Such as you can do the same thing with the ASQ-SE, look at children's scores over time. So I think longitudinally the total scores might tell you for that specific family, but we have not developed any guidelines. We haven't looked at any validity or reliability in terms of that total, the total score and the meaning of that.
Mm-hmm. Okay. I think we have time for one more question. So earlier in the presentation, you discussed that there can be some questions that may not be culturally appropriate for families or culturally sensitive. But could you give any examples of a question that may have received concerns that it's not culturally sensitive? And can you provide any potential ways that a provider may be able to work with the family if skipping over the question isn't, I guess that would be like, the easiest way is to skip over the question, but are there any ways that a provider can work with the family to kind of adapt the question, but still maintain validity with it?
There are some families, cultures, whatever, that don't talk a lot about their feelings and don't want to talk about depression with people, or certain kind of anxieties or things, or even partner violence, if that you don't talk about that with other people. So I couldn't give you a set, this is what you can do. I think, what we always try to do is have kind of brokers, if you will, cultural brokers, or people from the community that we pilot, questionnaires like this with, or even with the ASQ, and say, look this over, what do you see? If there's any things that look to you like they're not going to be appropriate, are there ways around that? Should we just skip that? So I would really get people in the community first to look at it, rather than kind of as a professional try to make judgments. But again, there's so much diversity, and even within cultures there's diversity, as individuals there is. So I think it's hard to give some sort of statement that would just say, yes, this question you can do this.
Mm-hmm.
I really agree with that. And I think the bottom line is that as professionals, we need to be sensitive to diversity and differences. And I think it's taken us a long time to get where we are, but I think today people are much more in tune with the variability of people's values and how they do things. And for me, that's the bottom line, is that we continue to look at and respect differences amongst families and cultures. And we have learned, getting into the translation business, we have learned a lot that if you'd asked me 40 years ago, I never would have guessed. And it can be very, very tricky and very challenging. But for me, the bottom line is being sensitive to differences and respect those differences.
Yeah. Okay, I think that's all the time we have for questions. I just have a couple other things to go over, but thank you, Jane and Diane, for fielding all those questions from our viewers.
Yeah, they were great. They were great questions. Thank you very much.
Yeah, very engaging audiences. Always have good audiences. Okay, so let me get myself, there we go. So certificates of attendance are available. For this webinar, you can download certificates from the handout section of the webinar panel. You can also go to this URL here on your screen. And you will also receive, as I said, a follow-up email tomorrow that'll have a link to watch your recording, and then all live viewers of the webinar will have a button in that email to download a certificate there as well. So there's a few options for you to get your certificate. We are providing a discount for all of our Coffee Chat viewers. So you can save 20% on most products at brookspublishing.com. Obviously, you can't save 20% on the ESQ because it's free, but you can use the code CoffeeChat at checkout and you can save 20%. We also have a number of other coffee chats. This is actually our last coffee chat for the early childhood winter session, but we have all of our coffee chats are recorded. And then we will be soon announcing our lineup for the coming spring coffee chats as well. So you can find those at bpub.fyi/coffee-chats. And if you're looking for additional resources to help you with virtual or remote work, we've put together a list of COVID-19 resources, including recommended readings, downloadable resources, and other professional development webinars. And those can all be found on the Brooks site at this URL here, bpub.fyi/COVID-EC. And you can also just go to the Brooks Publishing website, and then there's a little tab at the top for COVID-19 resources. And again, you can download the slide handouts from the handouts section to get all these URLs, and you'll also be receiving an email tomorrow that will have the slide handouts, so you can pull the URLs from there as well. And so with that, I'd like to thank all of our viewers today and all of our viewers from all of our previous coffee chats this fall. And then I'd like to say a huge thank you to Jane and Diane for presenting this excellent webinar and giving us a really good overview of the Environmental Screening Questionnaire.
Happy to do it.
Yeah, happy to do it. Thank you, Brooks, for giving us support and offering the ESQ as a download.
Yeah. All right. Well, thank you again, everyone, and I hope you have a great rest of your day.
Thank you.